honored that we have Dr. Arabella Pérez. Dr. Pérez is a licensed clinical social worker, college professor, and a therapist of 30 years. She holds a master's and a doctorate degree in social work from Tulane University in New Orleans. In addition to teaching at UNE, she provides technical assistance and consultation to states and communities on the development of trauma-informed systems. Just a few of her credentials: cultural competency, resiliency, secondary trauma-informed care and educational practices. That's just a few. We're going to ask if you have any questions, please raise your hand, which is located at the bottom of the screen, or post in the chat. Please join me in a warm virtual welcome for Dr. Pérez. Dr. Pérez.
Thank you so much. Glad to be here. Glad to see so many interested folks here. I know a few of you, either your former students or former colleagues that I've done this presentation for, that you've heard me speak. So what I'm going to be doing is sharing my screen. Know this, that getting a copy of this PowerPoint. So you can always take notes, but just also know that you're going to be getting a copy of this. I'll be sending this on to Roy after this presentation. So again, I'm so glad to see everyone here. All right. And please feel free to use the chat box if you have any issues. You need me to talk a little slower or a little faster, and Roy will let me know. So, all right, I'm just going to go ahead and start this presentation. All right. Okay. So I'm going to be talking about fostering resiliency in stressful times. And this has been a topic that I've been doing sort of the circuit since the start of the pandemic. Oh, and by the way, I just remind you, please mute yourself so that we don't have any feedback. Thank you so much. So my next slide would have been a Zoom poll, but couldn't make it work for today's presentation. So instead of it being a Zoom poll, what I'd like you to do is in the chat box, since the start of this year, what has been your average level of stress? So using a Likert scale, so a scale from 1 being totally cool to 10 being wicked stressed. What would you say your level of stress has been since the start of the new year? And if you feel uncomfortable letting folks know what your level of stress is, you can just privately, in the chat box, just go to me, my name, and just send me a number. And I'm going to go ahead and I'm going to start looking at some of those numbers to see what we have. All right, so we have some folks being really honest with a 10. Thank you. 3, 4, 2, 5, 6, 8, 8, 8, 10, 7, 8, 7, 8, 7, 8, 8, 2. Feel free to continue to add as I can keep talking. Professionally, thank you. Yep, someone said professionally, which is different than personal. And you can always distinguish it that way, or just arrive at an average if you'd like between the personal and the professional. So as you continue to type in there, I just want to share that my own sort of unofficial research has indicated that I would say lots of folks are hovering at about a 7 and an 8. So it's not unusual. And I asked for the average since the start of the new year, knowing that perhaps today is not as much. No, you will not be assigned more stress, Mike. That's not my role. But I just wanted to share that on average, folks are saying 7 and 8. Yes, folks are coming in under and over. I also want to identify that since the invasion of Ukraine, I'm noticing that folks are also identifying stress that would not have been there before. Before, most of the stress was pandemic related stress. Now many folks, especially when I'm talking to folks who are veterans, that is increasing their level of stress, whereas prior to Ukraine, their number would have been lower. So I just want to recognize the fact that we are definitely in challenging times right now. So thank you all for being vulnerable enough and sharing that. I really appreciate that. So what I'd like to do next, having done that exercise, for some of you, I may have activated you a bit. I may have gotten you thinking about stress. So at this point in time, what I'd like you to do is invite you to shut your cameras off just for this exercise. I do love seeing people, but for this exercise, you're welcome to shut your camera off. We're going to be doing a breathing exercise. So make sure that you're muted as well, and you're welcome to put your camera off. And we're going to be doing what I call left nostril breathing. So before we do that breathing, just make yourself comfortable. So wherever you're seated, whether it's on the floor, a couch, a chair, make yourself comfortable. So perhaps for you, that means having your feet gently pressing into the ground, perhaps your arms resting on an armrest, resting on your thighs. And again, I'm hearing some folks, so make sure that you're muted. So as you get comfortable, just roll your shoulders back and away, just allowing your spine to get a little straighter, yet relax at the same time. With your lips sealed, breathing in and out through your nose. And then what I'm going to do is invite you to raise your right index finger and just gently press it against your right nostril so that you're only going to be breathing in and out through the left nostril. Now, if you have a deviated septum or your nose is stuffy and that's causing you discomfort, you can release your hand from your nostril and just breathe in and out through both. But if it's available to you, just gently press against that right nostril, either keeping your eyes closed or cast down with your lips sealed. Inhaling a nice long, slow breath through that left nostril. Holding it at the top and then releasing that breath. And then holding it at the end. And let's do that again, breathing in through that left nostril. Holding at the top and releasing. Holding at the end and start again. And we'll do 45 seconds of left nostril breathing. So at your own pace, taking those nice, long, slow breaths. And then when you're ready, go ahead and release the right hand from your nostril, resuming your own breathing pattern here. And then when you're ready, you're welcome to look up at the screen, gently flutter your eyes open. You can even keep them closed as I describe this exercise, and I'm happy to also take questions if you have any in the comment box. So what we just did there is we pumped the brakes. So we got that parasympathetic nervous system back online, and the parasympathetic nervous system is connected to your left nostril. So think of it this way: left foot is the brake pedal, right foot is the gas pedal. If your left foot is the brake, then your left nostril is connected to that. So that's your brake. So you're pumping on your brakes. You're getting into that state of rest and relaxation by getting the parasympathetic nervous system back online. So perhaps if you were at that 8 or that 9 and feeling pretty stressed out, that breath work may have helped you. Right nostril, gas pedal. Sympathetic nervous system, simpático, that revs us up. There's nothing better than having a sympathetic nervous system. But when we're overly stressed, we feel like our foot is on the gas pedal, we're revving our engine, and that can be pretty exhausting to maintain that level of revved state for too long. So left nostril breathing, just a minute of it can be really helpful to get into that relaxed state. And again, you're welcome in the comment box if you'd like to share how you're feeling. I always welcome that. I love to hear how folks are doing. I do want to say that I would say for 95% of the population, that breath work is really helpful. There's 5% less helpful. And there's a variety of reasons for that. Usually for folks that have experienced significant trauma, being in their body for that period of time, being mindful and breathing can be pretty dysregulating. So if that's the case, if breath work doesn't work for you, then come out of it and find something else. And during this workshop, we'll be talking about other skills that you can use. So if breath work doesn't work for you, that's fine. Don't judge yourself. Find something else that does work. So thank you. I heard someone just say, Roy is saying, relax and open. Thank you for modeling that. So if anybody else wants to just put in the chat box how you're feeling, again, I welcome any and all comments there. So, all right. So from there, I want to talk, I'm going to be talking about individual and organizational stress, but I'm going to spend the bulk of our time really focusing on you individually. And as I do that, I also want to ground us in some language. So here's a slide that helps us differentiate between stress, worry, and anxiety. And the first part there, that stress, think of it as a continuum. Eustress being good stress, distress being that stress that frankly, I'm not interested in holding on to. So that's pretty distressing. And then in the middle is just sort of everyday stress that perhaps comes with cooking a meal, picking your child up from soccer. So that I would put that right there in the middle. So I'm curious if anybody wants to write in the chat box, what are some examples of good stress that you can think of? So what would be an example of good stress? That stress that perhaps we learn something from, where it's rewarding. So I'm seeing someone saying they're not seeing the right slide. So you should be seeing the stress slide. If you're not seeing the stress slide, please let me know. And folks aren't seeing it. Okay, so I'm going to do something different here. And thank you, I see some folks responding. Let me go out of my slides and do this again. All right, tell me, folks see this?
I can see it now.
Okay. So I was using the presenter version for myself. I guess that wasn't working. All right, so what I saw some folks do in terms of stress, examples of good stress would be expectations, deadlines. Some other examples of good stress would be planning for the birth of a child, planning for a wedding, starting a new job. Those are all examples of good stress. They're stressful, but there's something rewarding that's coming at the end of it. Michelle says a roller coaster ride. Yeah, I would say that could be eustress for sure. So that would be eustress. So those are examples of eustress. Can folks give me some examples of distress? So what are examples of stress that would be distressing? So bills, yes. Dentist, yeah. Angry people, yep. Yeah, medical procedures, yep. A sick parent, illness can be distressing, absolutely. And one of the things we're going to be talking about is how distress can become toxic. So I've seen finances. So to me, yes, if my bills are piling up, and yet I'm employed and I know that I can pay them, I just need to get myself organized enough to pay them, then that distress may not become toxic. But if I've lost my job, if I'm ill on top of all of that, and I have bills coming in, I'm worried about finances, that distress is likely to become toxic. And that's when it floods my system with stress hormones. So understanding the difference between good stress, everyday stress, distress, and then toxic stress. So thank you for all of that sharing. I really appreciate that. And then under that, we have two other concepts, worry and anxiety. And since the start of the pandemic, I would say that worry has certainly been more prevalent than it has been in the past. And you can read what it says right there. But the important thing to note, and this is a hyperlink if you click onto the stress proof brain when you get the PDF, the important thing to understand about worry is that it actually can help us be productive. It can help us problem solve. There was a study that was actually done with adolescents who were involved in corrections that demonstrated when adolescents were presented with stressful situations, but given opportunities to learn and practice skills, they developed more resiliency than their peers who were not given those opportunities. So we also know that if we worry about things, then we might become productive and learn some skills. The problem though is that when that unchecked worry sort of leads to stress and anxiety, and at the start of the pandemic, we saw a lot of that because folks just didn't know what to do. We were all in lockdown. We weren't quite sure how we were going to come out of that. So in the course of that period of time, problem solving was a little harder to come by. So that worry then became anxiety. And that's that 24/7 state. The population that's most impacted by anxiety right now are those youth between the ages of 16 to 21. So high school, college age youth are really experiencing anxiety at an all-time high. And the ways that it shows up is through dread, despair, resentment, procrastination, insecurity, projection, defensiveness. It is one of the most common treated diagnoses is anxiety. So we know that we have become an anxious population. So thank you for that. All right, so the next slide here is resiliency. So as I talked about stress, I want to talk about resiliency. And you likely have heard about resiliency as that concept where you bounce back. And yes, you do that. I often struggle with that definition because sometimes the bouncing back can be impacted by a system that's pressing on you. So it's really hard to bounce back from it. So I also want to acknowledge, and some folks did that when I asked you about stress, some of you went right to professional versus personal. So resiliency is the same thing. It's not a binary approach. It's not that you have it or you don't. It really has to do with the way that it shows up on that continuum, and it presents itself differently. So I can be really resilient in my personal life, but less so in my professional life because my professional setting might be toxic, caustic, stressful for a variety of reasons. So
Arabella, I'm sorry to,
yeah,
but it didn't advance.
It didn't advance?
No.
So this is really fascinating that it's doing this. Okay, so let me end my show and start again. Okay.
Oh, there it goes.
Well, it went there. So I'm going to keep it like this then. And because for some reason, it's just not advancing on, and I don't know why it's not. So here's the resiliency definition. So I'll let you look at that again since you weren't reading it. So just recognizing that resiliency shows up on a continuum and that we can be really resilient in one setting and less so in another setting. So that's the resiliency piece. The next slide here, trauma. So, and I'll let you read that definition as well. So the work that I do is specific to trauma-informed care and trauma therapy. And when I talk to folks about trauma, like Roy, for instance, Roy and I can be in a car accident together. And the next day after that car accident, Roy's back in the car, driving himself to work. I, on the other hand, had difficulty sleeping. I try and get behind the car, but I begin to have flashbacks about the accident. My heart starts to race, my head starts to pound. So obviously for Roy and for myself, that event had a different impact. So it's important to recognize that trauma certainly is an event, but also we want to look at what's the adverse effect on the individual's functioning because of that. And often the adverse effect has to do with the way the system responded to it. So if I use that example again, Roy and I are in a car accident, Roy's coming back into a home that's supportive. He knows that he can see his doctor because he has health insurance. So he feels pretty confident that he'll be okay. I, on the other hand, don't have health insurance. I'm going back into a chaotic home. I have a chaotic job I'm feeling pretty stressed about, and I'm having some back pain. So as you can tell, we have some other factors in our environment that determine if that trauma is going to have a lasting impact on us. So I just want to put that there for us. So just because a traumatic event looks like it's traumatic to you, we always want to check in with the individual to find out, does it have that lasting effect? All right. Okay. And then I want to talk a little bit about the brain here. So some of you probably are familiar with the brain, the way the brain works. So I love talking about the hand model of the brain, and this is the work of Dan Siegel. So the reason why I do the hand model of the brain is that when I'm doing psychoeducation with someone, I want them to understand that the way our brain is formed, we have the front of our brain, our prefrontal cortex, which was responsible for executive functioning. So when I'm at my optimal, like right now, talking to you, I'm using my prefrontal cortex. I'm using my executive functioning. If all of a sudden our Zoom got fuzzy and froze and I had difficulty continuing with the presentation, I might begin to lose it a little bit. And when I lose it, that means my prefrontal cortex starts to flip and I begin to feel some emotions. And the emotions are not really great emotions. I'm feeling really frustrated, I'm feeling angry. And as I'm feeling those emotions, and that's the middle of our brain right here, as we begin to feel those emotions in our limbic brain, this is where we might then get into that fight or flight or freeze, which you've heard those terms, I'm sure. So for lots of folks who've experienced trauma, and that trauma has gone unaddressed, has gone untreated, or it's been treated, but it hasn't been treated effectively, something might activate them. So what might activate them might be losing the job or getting stuck in traffic or listening to the news about Ukraine. And then as that's happening, our prefrontal cortex might start to go offline and we're in our feels. Now, I don't want to say that being in your feels is a bad thing because emotions are emotions. I don't want to assign an attribute to them. But what I do know is that, am I effective if I'm hanging out there? Maybe I am effective. But if I'm like yelling, if I'm sort of flooded with all of these sort of images, if I'm doubting myself and really doing some negative talk, if I'm doing that and I'm staying in that emotional brain, I'm less likely to be effective. So in the workplace, for instance, I want to figure out how to be effective. So how am I going to talk to my boss about that raise? Or how am I going to talk to my boss about the fact that I can't continue to work 50 hours? If in my emotional brain, I'm likely to be less effective. So I want to be able to bring my prefrontal cortex back online so that I can use my executive functioning. And what I did with you all, that left nostril breathing, is an example of how to get that prefrontal cortex, how to get your lid back down. The last thing I want to say about this is that because of the pandemic, especially at the start of the pandemic, and I was one of those where my lid wasn't coming all the way down. My lid was probably halfway up, if not maybe like a quarter of the way up. And I was kind of going around the world like that, hyper vigilant, looking around me, wondering who's masked, who's not, who's sick, who's not, am I going to get COVID? And that really was my brain just taking care of my body by having my lid up a little bit, but it was exhausting. So at the end of the day, that's likely when I felt fatigued and wanted to crash. So we want to be able to sort of practice self-compassion and recognize that for a variety of reasons, you might be going around life with your lid not all the way down, and you want to figure out how to get it down. I love this language. I was running late for a class the other day. I had to park illegally. And of course, there was sort of the UNE car patrol watching me. And I said, I'm going to just run in and tell my students that I'm late. And I ran in and I looked at my students and I said, I'm starting to flip my lid. I'll be back in 5 minutes. And they just laughed, but they knew what that meant. They knew it meant that I was pretty dysregulated. I was upset that I was running late. And I needed to figure out once I came back into class, let me just take a moment to do some breathing here so I can get regulated again and start class. So again, language, language, language. It helps us to understand. It's all about the brain, and it's our brain just helping us out. But sometimes our brain does things that is less effective, and we want to figure out how to be effective. And then finally here, we have this neuropsychological cycle that happens. This is how we're responding to chronic stress and trauma. So I gave you some examples there. So being stuck in traffic, having a work deadline, your children's schedule, you can just put something else in there, something that's activated you. And our brain's going to process that information. And when our brain takes in the information, it goes upstairs to the prefrontal cortex and it goes downstairs to the emotional brain. Unfortunately, it goes downstairs much faster than it goes upstairs. So I'm one of those that I'm inclined to get emotional, but I have to take a deep breath so that I let it get to my prefrontal cortex and decide, okay, we can figure this out. Stuck in traffic, I'm late for that workshop that I'm doing for Roy. What can I do? How can I contact him? Because of course, as our brain is processing the information, it's going to activate our sympathetic nervous system because our brain, is thinking, hey, you're out in the Serengeti and you're, being chased by a tiger. So I need to release some adrenaline so that you can run faster. I'm going to tense up your muscles and I'm going to increase your heart rate. But being stuck in traffic and being late for that Zoom meeting isn't a tiger chasing me. So if I can take a deep breath and allow my prefrontal cortex to back online, then I can interrupt this loop. All right. I will admit there are days that I'm successful at this, and there are some days that I am not, where I am stuck in this loop. And I really have to work even harder at finding some ways to regulate my body and get out of that loop. All right. And the last thing I want to talk about here with the brain has to do with our window of tolerance. So window of tolerance, I don't know how many folks have heard about the window of tolerance. I love talking about the window of tolerance. I love talking about it to educators because educators immediately can reflect back to me when they're out of their window of tolerance, when they see their students out of their window of tolerance. So in an ideal place, that yellow window is nice and big and bright. This is when I'm my most effective self, okay? Anything that comes to me, I can manage it. Okay, I likely am well resourced. What do I mean by that? I've probably had a good night's sleep. I'm probably fed. I'm not hangry. I probably am feeling like I'm well supported. My workload is manageable. So my window of tolerance is going to be a little larger here. Again, in the beginning of the pandemic, my window of tolerance was smaller. And my hyperarousal, that red window, was much larger. I tend to run hot. I don't tend to run hypo. I know that about myself. So what does that mean? I tend to be anxious, angry, and overwhelmed. That's more of where I am. I'm more of a fighter. So I tend to be more hyper aroused when I'm out of my window of tolerance. I have colleagues that are hypo. They're spacey, they're zoned out, they're numb, they're frozen. Again, think back to the beginning of the pandemic. We had lots of folks who were like, I'm in my pajamas. I can't get out of bed. I feel numb. That was classic hypoarousal. I was the opposite. I was like driving into every single grocery store, finding toilet paper, making lists and lists of meals, making sure that I could feed my family for 30 days and never have to leave the house. I think I probably lost 5 pounds from all the running around and lack of sleep that I was doing because I run hyper. I know that about myself. So what I'd love to ask you all, and use the chat box again, is as you see this slide, as you think about yourself, what do you do to get out of that hyper or hypo aroused state and expand that window of tolerance? So for instance, I mentioned breath work. I do a lot of breath work. I try 15 minutes a day to do a meditation that involves breath work, and that helps me. So that's something that I do. Workout, yes. Cardio, yes. Hiking or exercise, painting, long walks, getting outside, cleaning, running, yeah, for sure. Walking, chatting with friends, needing to process, yeah. Reading, call my mother, yeah. These are all wonderful examples. And one of the things I want to just note about these examples is that they're generally going to work for all of those states, but there's going to be some that'll be more effective than others. And I'll give you some examples of that. So if you're hypo aroused and you are numb, what's going to get you out of that hypo aroused state is cold water. I don't know if anybody ever takes like a quick 30 seconds of a cold shower, just letting that cold water run before you make it warm again. Or folks that jump into the cold ocean water, or dip their face or their hands in ice water, or drink something really cold, maybe have some ice cream. So the coldness helps to get, and I'm going to see some chats here, the coldness, what? Yeah, Nordic skiing. Yeah, being outside in the cold weather is really going to get you out of that hypo-aroused state. So what it's doing is that it's revving up the sympathetic nervous system, because I heard ice cream sign you up. Yeah, go ahead. So it's revving up the sympathetic nervous system when you introduce something cold if you're in a hypo-aroused state. Okay, if you're hyper aroused, this is where you likely hear about those bubble baths. And bubble baths are fine. I'm not saying don't take a bubble bath, but it's really warm water. That's what's going to help you if you're hyper aroused. Okay, so taking a nice warm bath, right? Because it's going to relax you. So drinking hot tea. So if you're at work, I don't expect you to go take a warm bath, but drinking some hot tea could be really helpful here. Running your hands under nice warm water, splashing your face with warm water. So water is really helpful. Another example, if you've ever been to an airport after 9/11, airports had rocking chairs, right? Rocking chairs. So what do the rocking chairs do? It's that rocking motion. So if you're hyper aroused, rocking motions, I have a yoga ball in my office that I sit on, and I can bounce on that, or I can move from side to side. So we know that movement helps if you're in that hyper aroused state. Okay, that's really, really helpful. So movement, dance, getting up and jumping, that can really help you. It can also help you with the hypo-aroused. I would say that the rocking action, though, research demonstrates is really helpful if you're hyper-aroused. So those are some examples. And then when it comes, and lots of folks said working out, great. I think all working out is fabulous. You also might want to tailor it and notice for yourself what's helpful. So I know that if I'm hyper-aroused, probably doing some nice gentle yoga versus I love hot power yoga. Hot power yoga sort of revs me up. So I'm going to probably do calm yoga. That might be restorative yoga, yoga nidra, which is divine sleep, or yin yoga, where you hold a pose for a period of time. That's going to be helpful. If I'm hypo, I'm going to do a more intense form of exercise. Folks mentioned cardio. That's really going to help me out if I'm hypo aroused. So play around with your exercise and notice some exercise might actually rev you up and you probably don't want to be. And yes, Margaret, my amethyst mat, definitely. I have a nice warm mat that I lie on that really helps me when I'm feeling hyper aroused. I lie on that and I do some deep breathing. Sarah, I love that you did doing dishes, because that's also the cold water for sure. So doing dishes and being mindful as you wash the dishes can be really helpful. So thank you all for commenting. Okay, so that's the window of tolerance. So let's talk about the difference between burnout and secondary traumatic stress, also known as vicarious trauma. And I'm going to leave the empathy, compassion, fatigue to the side for the moment, but I want to talk about burnout and secondary traumatic stress. So burnout, as recent as 2019, burnout is now classified as an occupational phenomenon. It was not prior to 2019. So this to me is another indicator that we live in pretty stressful times, and many of us do stressful work that we can burn out from. So the burnout, folks tend to confuse burnout with secondary traumatic stress. And I get why, because burnout, there's also a high correlation between burnout and secondary traumatic stress, and it can be a predictor. And yet if caught early, it can be seen as very different. And then the way you want to manage it, just like the hyper and hypo, might look different. Some might be the same, but some interventions may be different. So with the burnout, and I'll let you read that there, but with the burnout, I find that in this instance, I'm going home and I'm still feeling like, I don't know, still feeling safe. I'm not feeling hypervigilant. I'm not having intense thoughts about my work showing up, that intrusive imagery. I still feel like I can generally trust the environment around me, maybe not my employer for whatever reason, because I'm burnt out, but probably people around me. So at my core, there's still an integrity there. I still feel pretty confident in the way that I'm presenting. I'm just exhausted. I'm just burned out. I probably need a vacation. Okay? I need to figure out, maybe I need a new job. You know, the great resignation we're hearing so much about, a lot of that is burnout. Maybe I need a new job. Maybe I need to sort of ask to, I don't know, work less hours or with a lighter caseload. And of course, we also know that sometimes that's out of our control. So I want to acknowledge that. But that's the burnout piece. Secondary traumatic stress is that caregiver stress and strain that's experienced when we're working with individuals that have been impacted by trauma. And when I think about secondary traumatic stress, and I would again welcome you to put in the chat box, what do you see as some of the symptoms of secondary traumatic stress? So when you are impacted by the work that you're doing, working with individuals that have been impacted by trauma, you know, what impact is that having on you? Does anybody want to go ahead and make a comment? So I know for me, I tend to have rescue fantasies. I tend to, fatigue. Yeah, take it home to my family, not able to sleep, anxiety attacks. Yeah, I can't stop thinking about my day, lack of patience with everyone and everything, worrying. Yeah. I know that once I became a mother, which would have been 23 years ago, it looked very different, because all of a sudden I was worried about my child's safety to such an extent that I realized this isn't like really supposed to, like, I shouldn't be this worried about my child's safety, but it was because of the work that I was doing. You know, I was working at Tri-County Mental Health Services with young people who had been sexually abused, physically abused. So of course I was thinking about my own child's safety, and I was bringing that home with me. So I noticed that as a parent, I was feeling it a little differently than I had been before. So hypervigilance in public spaces. Yeah, Vic. And I think for me, I was very hypervigilant with my children in public spaces. So just noticing that about yourself. And again, no judgment here, just noticing when it's showing up and then figuring out, what do I want to do to manage that? And I don't have the slide here, but if I were to show you a slide of post-traumatic stress disorder and how it shows up in the diagnostic manual that we social workers use to diagnose, and I put that side by secondary traumatic stress, you would see that many of the symptoms are the same, which means that for many of us, we actually would qualify with a diagnosis of post-traumatic stress disorder. So what does that mean? Remember I said for burnout, it might mean going on vacation, the great resignation, thinking about, is this job working for me? Trying to figure out how can I alternate what I'm doing at work and mix it up a little bit. But if it's secondary traumatic stress, this might be the time to really talk to a therapist. Now, you can still talk to a therapist if you're burnt out, but secondary traumatic stress, I would be like, yes, please get yourself some assistance. Like think about, do you have an employee assistance program that you can utilize? Is there a support group you can go to? Is there some peer support that's available? So that you really can process what's going on and manage it effectively. So again, it might look a little different. So let's go back to empathy and compassion fatigue real quick here. So empathy and compassion tend to get interchanged. Empathy is that state of feeling for and with someone, and compassion builds on it. So compassion is empathy matched with action. So there's action with the empathy. So I know that I'm experiencing empathy when I'm doom scrolling, when I'm reading about Ukraine and what's happening. That's empathy, okay? The compassion would be if I start donating, or if I get involved in my local community at a soup kitchen and start volunteering, or if I make a meal for a neighbor who's a shut-in, then I'm involved in compassion. And this is the work of Tanya Zinger, who's done amazing research on this topic, where individuals, she's doing MRI scans of them, and as they are being told a story and feeling empathy about this person who the story is being told about, parts of the brain that are being activated are parts of the brain associated with negative states. Now, if you're in that MRI scan and you're told, now recollect a time where you helped a neighbor, or you helped out, a friend, or you volunteered, while also thinking about that really sort of tragic story. At that point, we see positive states of the brain being activated. So what the research demonstrates is that if you're involved in empathy only, if you doom scroll 24/7 or 5 days a week, you will burn out much quicker than if you were involved in acts of compassion. You might still burn out from acts of compassion, probably because you're fatigued, but you'll burn out differently. So what I say to folks is recognize empathy and compassion, and then figure out, how can I build more compassion in my life for myself? How can I create, and we're going to be talking about acts of compassion for yourself, while also acts of compassion in the community, okay? So what does it look like and feel like? So I was asking you all, how do you know when secondary traumatic stress shows up? And for this one, same thing. You can put in the chat box, maybe some of these resonate with you or you want to add to it. But how do you know when you really are sort of feeling burnt out, when you're feeling exhausted, when you're feeling drained? I know for me, there was a good 6 months that I had a frozen neck and I could not look past my left shoulder, which was a challenge when I was driving. This was my time working at Tri-County Mental Health Services, and the work that I was doing was really intense. And it was showing up in my body, because my body tells me, and I don't listen all the time, I've gotten better, but this was 30 years ago and I wasn't listening to my body. So listening to your body. So what does your body tell you? And I'm going to look at the chat box here. Nightmares. Yeah. Wanting to stay away from friends and family. Yeah. Those are ways that it could show up. So for me, shoulder tightness, right? Yeah. So release the shoulders, right? Difficulty with sleep, insomnia, withdrawal, avoidance. Absolutely. It's interesting about the shoulder. Who has tight jaws? Anybody? We got some tight jaw people here. I remember when I was seeing my dentist, probably about 25 years ago, and it was a new dentist, grinding teeth. That's right, Karen. And my dentist was looking at my teeth and he's like, what do you do for a living? And when I told him what I did, he's like, wow, you have a really severe case of grinding. And I could see that you clench your jaw when you sleep, So dentists generally know from our teeth how much stress we're experiencing. So thank you for sharing that. So one of the things that I say is release your shoulders, open your jaw, open your mouth a few times, play around with it. In yoga, we call it the lion, where we roar, but you're opening your mouth, okay? I chew the insides of my cheeks. Trisha, I used to do that as well. Yeah, I found a way to stop doing that, but yeah, I used to do that. I chew gum now to avoid doing that. Also, unclench your butt cheeks. I did a training for occupational therapy recently, and she had me laugh because she called it RBH, release butthole. Excuse me if I offended anybody, but I thought that's brilliant, RBH. And as soon as she said that, I think everybody in the audience must have done RBH, because I was like, whoa, I'm really clenching, like I'm really holding stuff in. Again, we're not always aware of it, right? So it really is helpful to sort of have your own script, roll shoulders back, open your mouth, unclench your butt cheeks, you know, and just allow yourself to sink in a little deeper. Okay, so those are things that we can do for sure. All right, so thank you for all that sharing. I really appreciate what you put in that chat box. So something to note here, I did a training and I am doing a series of trainings for the Portland school system with teachers. And it's been interesting because there have been a few teachers who've been working for a while who come into this space. It's really about self-care for them. And they come into the space and they're talking about sort of the larger system, you know, the larger educational system and their struggles with that, and they get stuck there. And I've been using this slide recently to help them. And this gets at the work of Stephen Covey here, the 7 Habits of Highly Effective People. So what I say to educators and what I will say to you is, what's the circle of control? What can you control, right? That's the center. What do you have control over? Then there's your circle of influence. Okay, this might be your coworkers, your friends, your family. So we may not have control over them, but we can influence them. That's your circle of influence. And for me, I generally stop right there. I generally try and focus at the end of the day, what was I able to control for myself? What was I able to control around me? Because the circle of concern is the stuff that can overwhelm me. Ukraine absolutely can be overwhelming. Okay. And you can add other things in there. So weather, politics, other people's behavior. I know, you know, at the height of the pandemic, whether or not people were wearing masks, I had to just think to myself, take care of you. Take care of you and your loved ones, okay? Because that circle of concern could be all consuming. And the longer I stay there, the more fatigued I'm going to get, because that's that empathy drain that I was talking about, okay? So circle of control, what do you have control over? And then as I've been talking about this, sort of, we've been throwing out some ideas of things you can do to manage getting in that window of tolerance, you know, helping to get that prefrontal cortex back online. In addition to that, I would say that we all need to practice emotional hygiene. And this is Guy Winch. There's a TED Talk that you can Google Guy Winch and hear his TED Talk. But this is really important because we keep talking about physical hygiene, but we don't really spend enough time talking about emotional hygiene. So with this one, we want to be able to name our emotions. So Dan Siegel says, name it to tame it. If you can name your emotion, then you can figure out how to tame the emotion if that's what you want to do. Okay, so you name the emotion. And then once you've named the emotion, you want to figure out, so what caused that emotion? What activated you? And how does it connect with your body? So you all gave me some great examples of how it was connecting with your bodies. So I know that when I'm angry and stressed, I'm going to clench my teeth and my shoulders are going to go up, my neck's going to get frozen. So I want to sort of relax that. And then I want to figure out, so what happened before that? What caused that anger to come up and bubble up? Okay. And then how can I manage my reactions? Because if it's Zoom, and there's a reason why I'm here in my home and not in my office, because at the UNE campus, Zoom has been a hot mess. So I know that if I was there, it would be cutting out, the screen would be freezing. So I know enough about that to be like, yeah, I'm not going to do Zoom there. I'm going to do it here so that I can manage my reactions. And this was me adjusting and learning. Okay. So giving yourself a timeline. So in the event that you do have a moment where you emotionally you dysregulate, what's the timeline? What happened there? Name it, and then hopefully you can tame it if that's what you want to do. Okay. And then self-compassion. So you heard me talk earlier about compassion and resiliency. And even though I talked about secondary traumatic stress and vicarious trauma, there is such a thing as vicarious resiliency. And I really want to stress this to everyone here, because you might be burnt out. You might be experiencing secondary traumatic stress. And I'll speak for myself. I also experienced vicarious resiliency. I also enjoy seeing the growth in the clients that I work with, in the students that I work with. I also get a great deal of compassion satisfaction by being in this space and presenting to you. I get a lot of pleasure from sharing techniques and also having you share techniques with me. So these are ways that I build my self-compassion. So it's that being piece, the feeling piece, matched with the doing piece. And that's how we achieve mindfulness. So that's self-compassion. Okay. And the last thing I want to talk about here is just the 6 domains of resilience. When we think about building resiliency, there's 6 domains to it. These are predictive factors. There's your vision. So do you have a clear purpose and goal for yourself? And does your work match that vision? Are you emotionally regulated? Do you practice emotional hygiene? Do you have those problem-solving skills to help you manage when you're dysregulated, when you're worried and anxious? Do you have tenacity? Are you persistent? Are you realistic? Are you optimistic? I'm not always that. I probably am more of a pragmatic individual, but I would say that even my pragmatism has served me well. Like I know that if I'm centered in that pragmatism, I have some tenacity there. I'm not going to give up that quickly. I'm going to hold on to hope. Health. Can't speak enough about nutrition, sleep, and exercise and the value of all of that. I will say this about sleep. We do vary, so some folks 8 hours is necessary. For others, it's 10. Some it's 6. It varies. You know yourself best. So I don't want to prescribe you sort of a slip that says, Roy, you will get 8 hours of sleep, because you might say to me, 6 is enough for me or 7 is enough for me. So figure out what works for you. Same thing with nutrition and exercise. Figure out what works for you and then do more of that. And then lastly, collaborate. So creating supportive networks, identifying people in your network, in your relationships that are supportive, and those that aren't, okay, we might have to have a conversation about that, right? You might have to figure out who are the people that fill me up versus those that drain me, and how can I better manage that, okay? So the next few slides that I have really have to do with organizational resiliency. And what I'm going to do is just share one slide with you, knowing that I want to spend some time doing one more activity and then answering questions. But I do want to say the following, is that I recognize that as we're having this conversation, the focus is on you. Focus is on how you can become more resilient. And when I've been doing these talks, every now and again, someone says to me, Arabella, I can do all of that, but if I'm in an organization that's not resilient, that's not fair. And my response is absolutely. So I also recognize and work with organizations to help them become resilient organizations, to help them become healing organizations. And if they can be healing organizations, it may allow you to really tap into your resiliency, right? So this is a slide from this is actually from the public health department in San Francisco that I did some work with. And I loved how they took many of the principles that I was sharing with you and that I share with others to get at an organization that's been trauma organized to one that's trauma informed. And what San Francisco did, and I love that they did this, is they were like, and Arabella, that's not enough for us. We want to be a healing organization. We want to make meaning out of the past, and we want to grow. We want to be relational. So I want to leave you with that as you think about all of the resiliency, all of the trauma and toxic stress, how you can manage it while recognizing that, it's helpful to be in systems that also want to do some work and also want to manage that. Okay. All right. I'm going to leave you this one activity, and then I'm going to stop sharing. So this is a grounding activity, and I love it. It's a call and response. And what I'll be doing is, and I'll do it with you a few times. So what I do is I do the first part. I do the question, and then you do the response. And if you're in a space without people, you can just, say it out loud. You can say it out loud if there are people, whatever you want, or you can just say it to yourself. So it's a grounding exercise that really is about practicing self-compassion. So I'll say the question, and then I'm going to respond in kind with you. So it starts with, where am I? Here. What time is it? Now. What am I doing? The best I can. Let's do that again together. Where am I? Here. What time is it? Now. What am I doing? The best I can. And what I'd like to do is I'd like to welcome you all to unmute yourselves if you're able to, so that we can bring all of your voices into this space. So if you can unmute yourself, and we'll do that activity again, and we'll bring some energy. Already here. Where am I?
Here.
What time is it?
Now.
What am I doing?
The best I can.
can.
Thank you all so much. All right. And my last slide, there's some resources that you'll get if you're interested in reading a little more about some of the techniques that I did here. I'm going to stop sharing and just take some questions that folks have with the last 8 minutes that I have. And again, you're welcome to either raise your hand if you have a question or place it in the chat box. Can I do a training for DOE? Margaret, you know I absolutely can. Not to mention, I want to do anything that you're involved in, so. Other questions that folks have? So what
Well, I have a question.
Go ahead.
When you have a person who has reached the last straw, and they're at the point where they've already reached out to someone and that's not helping, and they're at the point where they just are helpless and they don't know what to do, what advice would you give them?
Wow, that's a really hard one, Roy.
This is a real one, by the way.
I'm sure it's real. I've been there as well. So here's the thing about that one that I often struggle with, because if you're privileged enough that you can leave that place of employment and go somewhere else, then that often is the solution. But not everyone is. Like, not everyone has the ability to move from one position to another position. And this is, I think, the reason why we're seeing the great resignation, where we're seeing so many individuals leaving their professions because they're realizing it's not working. Like, it's morally injurious to me. So I know that I have to leave that. So what I do say to folks when I work with them is really sort of like do a pros and cons around what happens if you stay, knowing that change isn't going to happen. You know, are there some skills that you can continue to practice individually and manage? Or is it such that it's unmanageable and you know that no amount of skills is going to help you? So it's all about agency. So when I'm working with somebody, and I work with lots of people who are struggling with this, we do that pros and cons. When we really figure out, you know, what is the long-term impact? Are there other options? Knowing that, again, remember I did the circle of control, influence, and concern. If I'm working in a system that's not changing, and I work with systems that are pretty intractable, you know, and it's really hard. And sometimes what I say to folks is that, is there something within that? Can you make a small goal for yourself where you can feel some success, knowing that the larger system is such that it's much harder to see success? So I firmly believe that if you've done all of that, if there perhaps is someone, whether it's a therapist or a trusted person or even sort of a coach that you can talk to really sort of think about those pros and cons, to help you think through those next steps, then that might be a way to manage it. There's no easy answer to that question, though. Yeah, it does require some sacrifice for sure.
Thank you.
Yeah. Also, I saw in the chat box that folks were asking if the PowerPoint will be available. So folks may have joined later. Yes, it is available. It will be sent to you. I'm also putting my email address so that if you have, because some folks are reaching out to me, and if you have questions and you would like to talk to me, you can email me at aperez3@une.edu. So. Anything else before we close our time together?
The long-term effects of PTSD, stress, toxic stress on the body, long-term, if it's not addressed, and it gets into your psyche.
Yeah, so I sort of went through the neuropsychological response cycle rather quickly with you all, but we do know, and studies demonstrate, that when our bodies are under pressure, when our stress hormones are at an all-time high, it does take a toll on us. It takes a toll on our adrenal glands, on our kidneys, on our heart. We know there's studies that demonstrate, depending on the number of adverse experiences that you've had, and I actually have added to the adverse experiences, there's a slide called Racing Aces that I shared with Roy that I'm sure Roy can include. But under those 10 adverse experiences, we know there's historical, racial, systemic trauma, and that also can have an impact on your psyche. So it's really important just to be aware that, and this is where the psychoeducation shows up, that nothing is wrong with you, that you are not defective, that these are things that are happening and our body is primed to survive. It really is. So what does that mean? Our body's primed to survive because it thinks we're being chased by a lion in the Serengeti, even though we're not. So the continual spritzing of those stress hormones really is our body saying, survive, survive, survive. But we've been unable over time, especially if you have a trauma history, to manage and regulate and metabolize all of those stress hormones. So again, I can't stress enough the importance of sort of knowing your narrative, getting some assistance, figuring out the techniques that are going to help you manage all of the above, for sure. And provide psychoed, talk to other folks, like spread the good news, let people know. I did this, a workshop for the College of Dental Medicine, and one of the faculty came up to me and said, Arabella, one of my dearest friends who's a dentist, I've been taking screenshots of your presentation. He just got admitted to the hospital yesterday. He had a heart attack. He has a toxic work environment. The stress is killing him. And I've told him repeatedly. So I get it. Yeah. And that wasn't his fault. It wasn't his fault. So what life changes might he be able to make so that he can metabolize that trauma and get himself out of a toxic situation? Yeah. So how do you move from empathy to compassion? So what I say to folks is, if you're in that, well, first of all, put the phone down if you're doing the doom scrolling. And I was doing a lot of that in the start of the pandemic, and I'm doing a lot of that with Ukraine. So I try and sort of metabolize the information, figure out how much I can take in one day. And then the other thing I would do is get involved. So I did a presentation with the CDC last month, and I kept stressing over and over again, get out there in your community, do something. It's so important to be involved. Now, I know I'm probably talking to busy people, so volunteering might be out of the question, and that's fine too. But finding ways to get involved in your community, helping neighbors, helping friends. I just love helping people in general. Like if I'm in the grocery store and somebody's having a hard time reaching for something, I'm going to reach for it. If I see somebody who's lost in the old port and they're a tourist, I'm going to tell them where to go. I mean, just helping people is incredibly satisfying. So I would say find opportunities where you can help people. Yeah, that helps you move into compassion. Yeah. And the same thing for yourself. Same thing for yourself. Yeah. 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 It is easy to forget. Yeah. So being compassionate to yourself, Vic, for sure. Yeah. That's why that technique of the call and response is really helpful. It's just reminding yourself that you're doing the best you can. Okay. I'm in the present. I am here. The time is now, and I am doing the best I can. That's an act of compassion. Oh, well, I think our time is up, and this has been so enjoyable. I've loved reading all the comments in the chat box. I love seeing my former students here as well. So, yeah.
Arabella, I think I speak for everyone when I can say that this was incredible. We appreciate you coming along and doing this. The information was fabulous, and hopefully we can take it back to our everyday lives and use it and make great purpose with it. So thank you very much.
You're all welcome. Have a great day.
Okay, thank you. We'll talk soon.